Hi guys, welcome back. Today we're going to do something a little bit different and we're going to be learning how to do CPR. CPR is something that is done when somebody is in cardiac arrest. To help me explain this more, let me introduce my friend John. So John, what is a cardiac arrest?
A cardiac arrest is a serious medical event when the heart stops pumping blood around the body. This can either be when it goes into a rhythm where it can't pump blood around the body, or it's when the heart stops.
Which is bad.
CPR is done to keep the blood flowing around the person's body. This increases their chance of survival.
Which is good.
So, what is CPR?
CPR stands for cardiopulmonary resuscitation.
This involves chest compressions, which helps the heart pump blood around the body.
During COVID, the guidelines have been modified and mouth-to-mouth is no longer recommended.
If a person goes into cardiac arrest, blood flow to the brain will stop. This means they will usually become immediately unconscious.
So to help us explain when to do CPR, let us introduce you to our other friend, Anne. As you can see, Anne doesn't talk much.
So, if you come across or see somebody become unconscious, first of all we need to check for dangers.
Examples of dangers can include cars, if the person is on a road, slippery surfaces, broken glass, or water, if the person has fallen into deep or fast-flowing water.
It is important to make sure it's safe to approach the casualty. If it is not safe, do not approach the casualty. Go and get help by phoning the emergency services such as the ambulance service, police, fire, or even Coast Guard.
Time for an outfit change. So, after you've decided that it's safe to approach, you first need to look for a response. Are they alert? Are their eyes open? Or are they looking around?
If they're not, check to see if they respond to your voice. You can do this by shouting, "Can you hear me?" If they don't respond to this, gently shake their shoulders.
If they don't respond to this, they are unresponsive.
Someone who is in cardiac arrest will usually stop breathing. This is your biggest clue that they're in cardiac arrest. First of all, we're going to check and open the airway. We do this by looking inside the mouth, then performing a head tilt chin lift. We do this by putting two fingers on the chin, one hand on the top of the head, and gently tilting the head back. So how can we check for breathing? During the change regulations, look for signs of breathing, but don't put your face too close to the casualty's mouth or nose. We can look for rise and fall of the chest or abdomen. If there is a risk of infection, place a towel or a cloth over the patient's mouth and nose. Check breathing for 10 seconds. This is enough time to check for normal breathing. There is something known as agonal breathing, which is present after some cardiac arrests. This involves movement of the chest and mouth, but is not normal breathing. Breathing must be in, out, in, out, in, out. If they're not breathing, this is when you need to do CPR.
But first, we need to make a call. We need to make sure that an ambulance is on its way. Call or ask somebody else to call 999 and let them know exactly where we are and that the casualty is not breathing. They will then talk you through how to do CPR.
You can also ask somebody to go and get a defibrillator if you know there is one nearby. If there is a registered community public access defibrillator, the ambulance service will tell you on the phone.
So once you're sure that help is on its way, let's start CPR.
Whilst kneeling next to the casualty, place one hand on the lower half of the sternum, then place the other hand on top, interlock your fingers, then using straight arms, push 5 to 6 centimetres at a rate of 100 to 120 beats per minute.
Is there a song that you can use to remember the rate?
Yep, traditionally it used to be Nelly the Elephant and then more recently Staying Alive.
Isn't there a more recent popular song?
I don't know, Sally, is there? Really? You need to continue chest compressions until either you become too tired, someone arrives and tells you to stop, like a paramedic, or the casualty starts breathing normally. Remember, if you're using a defibrillator, it also may tell you to stop at times. Remember, rate, depth, and don't stop. So now you know how to do CPR, let's have a quick recap of what we need to do. If you find someone collapsed, the first thing you need to do is check for danger.
The next thing you need to do is check for a response. You do this by trying to get a response from your voice, if not, by gently shaking the shoulders.
Then we need to check and open the airway. We do this by doing a head tilt, chin lift.
Then check for breathing for 10 seconds. If the patient isn't breathing, we then need to call for an ambulance and send somebody for a defibrillator if there is one nearby.
So then we start chest compressions, putting our hands in the centre of the chest, pushing hard at a rate of 100 to 120 beats per minute, pushing 5 to 6 centimetres each time. Keep doing chest compressions until help arrives and you are told to stop by the ambulance service, or you become too tired, but remember you can take it in turns and do 2 minutes each with somebody else, or if the patient starts breathing again. If you are using a defibrillator, this also may tell you to stop sometimes.
So now you know how to do CPR.